Hello everyone, I am here today with Miss Palin, who recently reviewed some interesting research in her field of expertise.
Well, Mr. King, can I first say it is an honor to be on your show, Day Talk.
I am honored to have you.
Thanks.
So back to business, what is this research you recently reviewed?
Well, Mr. King.
Call me Larry.
Okay, well, Larry, the research study I reviewed was titled Barriers to Addressing Patient Sexuality in Nursing Practice.
You know this is a family show, correct?
Yes, of course, Larry, it is PG, I promise.
Okay, great. Continue.
Yes, well, it was mostly regarding the general lack of sexual assessment in a nursing assessment.
I see. You know, I used to evaluate lots of research articles myself.
Oh, really?
Yes. Would you mind if I asked you an obnoxiously long string of questions?
Not at all. I am a politician, you know.
Ha ha, of course. So first question then. Did the abstract include key elements of purpose, design, sample, selected results, and conclusions?
The abstract only included information on purpose and conclusions. The design, sample, and results were only available if read within the full text.
What is the study problem?
The difficulty nurses have discussing and assessing patients' sexual issues.
What is the study purpose?
To evaluate if the difficulty comes from salient nurse attitudes and beliefs, or possible from demographic information such as patient type, years worked as a nurse, etc.
Does the literature review include current, relevant previous studies and theories?
Yes, the literature review includes at least 3 recent pieces and many more that are not as recent. All were relevant.
Is a particular theory or model identified as a framework for the study? Is a map or model of the framework provided for clarity?
A descriptive, correlational study was used. A map or model was not included, though the study was easy to follow without one.
Are research objectives, questions, or hypotheses used to direct the conduct of the study? Identify these.
What are the potential barriers for nurses not incorporating sexual assessment, evaluation, and counseling into nursing practice?
Are the major variables identified and defined?
The independent variable is the nurse's attitude and beliefs. If the attitude and beliefs are changed, this would increase the nurse's ability and want to address the patient's sexuality. The dependent variable is addressing the patient's sexuality. This is dependent on the nurse's attitude and beliefs.
What attribute or demographic variables are examined in the study?
Type of patient cared for, medical, surgical, or oncology, nurse's age, nurse's years of professional experience, and attendance at sexuality workshops.
What design was used to conduct the study?
A descriptive, correlational study was used.
Does the study include a treatment or intervention?
The study suggests educational programs to help nurses understand how to include sexual assessments and why they are important, but does not implement them for the study.
What was the inclusion and exclusion sample criteria?
There was none. All nurses were included that worked in the care areas selected.
Can you identify the sampling method?
A convenience sample was taken from nurses working at the research hospital.
Discuss the sample size, power analysis, acceptance rate, and attrition rate.
Well, Larry, an ANOVA power analysis with alpha set at 0.05 and power set at 0.08 indicated that a sample size of 132 was needed, so our sample size of 148 nurses was sufficient. All nurses accepted, and there was no attrition.
Was institutional review board approval obtained from the university and/or agency in which the study was conducted? Was informed consent obtained from the subjects?
No, we waterboarded the nurses until they told us what we wanted to know.
What?
I'm just kidding, Larry. Approval for the study was obtained from the Wayne State University, and consent was implied with a return survey being filled out.
Oh, what was the study setting?
The study setting was several care areas including inpatient and outpatient clinics at a metropolitan hospital in Detroit, Michigan.
Can you identify the name of each measurement method, the type of measurement method, and reliability and validity of the scales used.
The instrument used. Sexual Attitudes and Beliefs Survey (SABS) using a 6-point Likert response format. 1 equals strongly disagree to 6 equals strongly agree is accurate and reliable. The survey used follows the Likert format, which is an industry standard.
How were study procedures implemented and data collected during the study?
Data collectors handed questionnaires to nurses while at work during a 2-day period. An anonymous questionnaire was given to nurses to fill out without putting any identifying information on a sheet. All questionnaires were returned in sealed, unmarked envelopes whether completed or not. Also, a demographic sheet was used to obtain information about levels of professional education, years worked as a nurse, and characteristics of the work environment.
What analysis techniques are used to describe the sample?
Statistics such as mean and standard deviation to describe the ages of the nurses and years worked in the profession.
What were the statistical procedures, the statistics, and specific results?
Statistics included correlational tests, SABS, t-tests, and analysis of variance, ANOVA. SABS test results showed the most common barrier was the belief that discussing sexuality causes the patient anxiety. The greatest barrier came from the nurses' belief that patients do not expect nurses to discuss sexual concerns, and that 72.3% of nurses believed giving patients permission to talk about sexual concerns was a nursing responsibility. However, only 1/3 actually made the time to do so. A t-test was used to determine whether SABS mean scores differed for nurses attending sexuality seminars compared to nurses who had not. Mean scores for nurses who attended sexuality seminars were significantly lower than nurses who did not attend this type of seminar. Lower numbers indicate a higher likelihood to address sexual concerns. The ANOVA test revealed a significant difference in responses of nurses as to the type of patient cared for, whether medical, surgical, or oncology. Any p-value less than 0.05 is significant, and the p-value in this test was 0.005. Surgical nurses were less likely than oncology nurses to consider discussing sexuality with patients essential to their health outcomes.
That was a mouthful.
I know, right?
What is the researchers' interpretation of the findings?
The researchers' interpretation was that many barriers lower the chance nurses will address sexual issues with patients, including care area, age of nurses, and personal beliefs and attitudes.
What limitations of the study are identified by the researchers?
Limitations include small sample size and using a convenience sample.
What conclusions did the researchers identify based on this study and previous research?
Attitudes and beliefs of nurses, low time availability, personal comfort and confidence in addressing human sexuality, and what a nurse believes a patient expects from them, are all barriers to nurses addressing patient sexuality.
What implications do the findings have for nursing practice?
Implications include showing a need for additional education in this area for nurses.
What suggestions are made for further studies?
Further studies to define the differences between care areas and a larger study to include multiple geographical areas and a larger sample are suggested.
Wow, you answered all my questions accurately. How did you manage to do that?
Oh, it only took 5 weeks or so of class and lots of caffeine and sugar.
What?
Nothing, never mind.